My name is Scott, and today I'm going to be talking about tracheal suctioning. So, you want to evaluate your indications for the patient. If they have a mucus plug, or if you hear them coughing, then that's a good sign for you to kind of go check and assess your patient. While checking the patient, you should listen for lung sounds, and if you hear any kind of crackles or coarse crackles, then that kind of gives you an indication that they might have something or secretions down there that you could be suctioning for a trach patient. So, with that being said, you have complications such as, or hazards and complications such as you're suctioning, you gotta watch out for atelectasis or bronchospasm to the patient. It can cause irritation, pain, bleeding, and bronchospasm. And contraindications would be that you should watch out for patients who are like hemodynamically unstable. So watch out for their blood pressure, their heart rate, or something like that. It can cause high intracranial pressure. It can increase, which is not good. But there is no, there really is no like severe actual contraindication to tell you not to do it. Because if a patient does have a mucus plug, it can't breathe due to like hypoxia or hypoxemia and the mucus plug, then you do need to suction them. You would just need to be kind of quick with it. You have to gather your necessary equipment first, which for me today would be a pulse ox, stethoscope, and your sterile suctioning kit. And after that, review the patient's charts and the physician's order. And remember that suctioning is not on an it's not like on an hourly order. You kind of just do it as needed. It's prescribed as needed. Okay, so remember to wash your hands. There's hand sanitizer right here. Okay, so now go to the patient's room. Hello, my name is Scott, and I'm a student respiratory therapist. Today I'm going to be suctioning your trach area. So explain what you're going to do to them, and explain to them and the family member what's going to happen. So I'm going to suction you out. It's going to cause a little bit of pain and irritation, and I'll just be as quick as I can. And can I get your name? Can I get your first name and your date of birth, please? And then when they tell you, Mr. Parker, you check their medical record number, which is on the side of the wrist, somewhere right here. So after you check, you're going to want to put some gloves on. Want to make sure that the patient is in like a kind of supine position, kind of ish. And then you want to make sure you check the room safety. So now, since this is a trach patient, he has humidifier on him, so remember that. Check for the manual resuscitator, like umbu bag, obturator, in case if the trach comes out. You want to do your 3-step check, which means you check your umbu bag. You see the pressure comes out. If the duckbill is flapping out, occlude it, and you should still be able to basically give out breaths. And then do it, hold it, and occlude it, and let go. It should still inflate. That is your 3-step check. All that is here. In case of emergencies, when you do need to bag a patient, you want to make sure that you occlude their stoma site, and then that's when you go and you put the bag over, and then you give them breaths. Okay, and then when you do suction the patient, you want to make sure that for an adult, it's going to be 120 to 150. So infants would be 80 to 100, and children would be 100 to 120. Adults are 120 to 150. Yeah. So I'm gonna do a little assessment. I'm gonna put the pulse ox, check their oxygenation level. All right. Listen to breath sounds. Deep breaths in and out. Okay. So, upon listening, I heard crackles and coarse crackles. So you kind of heard noises down there. oh, okay, you need suctioning. So yeah, now you want to make sure you take off whatever device he's on, or my bad, you have to hyperoxygenate the patient first for 30 seconds, and then when you're done with that, then you take them off of their humidification. Let them know what you're doing. You're going to be kind of close to their face. Okay, I'm just gonna take off this. Okay. Move this over here. Right. Pull socks off. Take your gloves off, and now you're going to work on your sterile. This is your sterile kit. So you want to open the bag. Okay. Keep it sterile. And then you have your little container, which you're going to put saline in. So you kind of want to take the container. Alright, don't contaminate the gloves. And you're going to put saline in the container. And this is what you're going to use to kind of, you're going to rinse out your catheter each time when you suction. So now you worry about your sterile technique. Come in, make sure when you put your finger in, you go out and in. You can worry about adjusting after. Take the other one out. Put your hands in. Now you can worry about adjusting. Okay. So I think this is gonna be my clean hand. This is gonna be my dirty hand. So clean hand. I'm gonna hold this. Dirty hand, which is gonna do the suctioning. You're gonna hold everything else. All right. So now you have this. You're gonna, there we go. Make sure that the catheter doesn't touch the unsterile part. Okay. So this is my clean hand, and this is my unsterile hand. Alright. When you go down to suction, you want to make sure that you're not taking any longer than 15 seconds. Less than 15 seconds is great. So when you go in, kind of try to go in fast, but make sure you don't go all the way down and hit the carina, because then it can really hurt. So just kind of go down and try to feel that pressure a little bit, and then pull out. When you suction, you want to intermittently do it, so twisting. Alright, ready? So I'm going to go in right now. I'm going to suction. You don't want to hold the suction until you're all the way down. So ready, it's going in, alright? Get down there, hold it, and then pull and intermittently do it, let go, pull, take it out, okay? And it should be less than 15 seconds. And then you can look at the patient, check, see if they're doing alright. Okay, you have your little thing right here. You can suction it out, clean it out a little bit. Now you go, do you need it one more time? Oh yeah, I'm feeling kind of, there might be still something still down there. So you go again. Okay, ready? I'm going to do it one more time, okay? You put down, go in, boom, 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 boom. Suction, intermittently suction, 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 come out, okay? Okay, he feels like he's doing good. I think he's doing good too. So now, what I do is, I'm going to take this off, around my fingers, okay? At this point, you're going to monitor the patient. Take the gloves off and change to another pair of gloves. After you're done suctioning the patient, you're going to reassess. And then you're going to post-oxygenate the patient too. So if he's on a vent, you put him back on, turn on the oxygen, hyperoxygenate them again. Yeah, okay? And then after that, you're gonna put him back on humidification. Alright. Alright. And then you're gonna check their oxygen level one more time. Pulse ox. Alright. Take and listen to their lung sounds one more time. No. Okay. Go in. Take a listen. Okay. Take a listen. Take a listen. Deep breath in, deep breath out. Okay. Okay. So pages sounds much clearer, sounds better. Ask the patient if they're doing okay, if there's anything else that you could do for them. So if they want to lay back down or sit down like this, and that's all you need to do. Make sure to get your pulse ox. Make sure you gather your equipment and you toss them. So throw them away. Throw them away. You know. And then make sure you write down in your charts your findings, your significant findings, and all that. Write down everything that they need, and then yeah. Trying to think if there's anything else. Oh yeah, if you need to resuscitate them, then you can use the blue bag. And then if my bad, I'm sorry. So the difference of the trach. So endotracheal tube is longer than a trach. So yes, this is a little bit shorter. Okay. All right. All right. So yeah. Just gather your necessary equipment, toss them out, and then after that you already chart your findings and you'll be good. Let the patient know that you'll be back, or if they need anything to call you, and then you can yeah, you can leave the room. Yeah. Oh yeah. Don't forget to check the catheter size. You need to check the patient's trach. And if the trach says 8 or 6, then you just times that number by 2, and then you go down one size. So say if it's a 8, it's a 16, then you go down one size and it's 14. Yeah? Okay. Thank you.